Mesothelioma. There are several treatment options available for mesothelioma, depending on the stage of cancer and overall health of the patient. The main treatment categories are surgery, chemotherapy, radiation therapy, immunotherapies, and targeted drug therapies. Surgery: for early-stage mesothelioma near the chest wall or diaphragm, surgery called extrapleural pneumonectomy may be performed to remove the lining of the lung, diaphragm, and pericardium. Sometimes parts of the lining around the heart are also removed. For select patients, this may provide the best chance of cure by removing all visible cancer tissue. However, it is a risky procedure with significant morbidity and mortality rates. Chemotherapy: the main chemotherapy drugs used for mesothelioma are pemetrexed, Alimta, cisplatin or carboplatin. Usually cisplatin or carboplatin is combined with pemetrexed. Chemotherapy may be given systemically through and for before or after surgery to try and kill any remaining cancer cells. It can also be used as the primary or only treatment for mesothelioma that cannot be removed surgically. Long-term maintenance treatment with pemetrexed may help prolong survival. Side effects can include fatigue, nausea, vomiting, blood disorders, and neuropathy. Radiation therapy: radiation may be used along with chemotherapy or after surgery to target any remaining cancer cells and relieve symptoms from mesothelioma pressing on vital structures. Types of radiation used include intensity-modulated radiation therapy, IMRT, stereotactic body radiation therapy, SBRT, and proton beam therapy. Side effects depend on the area being treated but can include skin irritation, fatigue, and lung inflammation. Immunotherapies: immunotherapies like anti-PD-1 and anti-PD-L1 drugs work by helping the immune system better recognize and attack cancer cells. Drugs like nivolumab and pembrolizumab have shown some effectiveness for treating mesothelioma. They are generally well tolerated but can cause fatigue, rash, diarrhea, and pneumonitis. Combining these with other therapies may improve outcomes. Targeted drug therapies: targeted drug therapies like ruxolitinib, everolimus and other kinase inhibitors block specific proteins involved in cancer growth and survival. Some are being studied alone or combined with other treatments, but more research is still needed. Side effects are usually mild and manageable. Supportive care: managing pain and other symptoms is an important part of care for mesothelioma patients at any stage. This may involve medications, oxygen therapy, nerve blocks, pleural effusions drainage, or other palliative measures to improve quality of life. Sarcoma. Treatment for sarcoma depends on the location, size and grade, staging of the tumor. Common approaches include surgery, chemotherapy, radiation therapy or a combination of these. Surgery: the main treatment for localized sarcoma is complete surgical removal with wide margins of normal tissue around the tumor. Sometimes limb-sparing surgery can be done instead of amputation. Advanced imaging helps surgeons preserve organ and nerve function. For recurrent, metastatic or high-grade sarcoma not amenable to surgery, other options below are considered. Chemotherapy: chemotherapy uses powerful drugs to kill fast-growing cancer cells. It is often given before or after surgical removal of the tumor to kill any remaining microscopic cancer cells. Common chemo regimens include combinations of doxorubicin, ifosfamide, dacarbazine or gemcitabine depending on the sarcoma subtype. This has important side effects like nausea, fatigue, blood disorders requiring growth factor support. Radiation therapy: radiation uses high-energy beams to kill cancer cells and shrink tumors. It may be administered before or after surgery to address any remaining cancer deposits. Radiation is also useful for palliating painful bone sarcomas not operable. Side effects vary depending on areas irradiated but can include skin reddening, fatigue and potential long-term effects on organs like lung, heart. Targeted therapy: drugs that target specific sarcoma-related molecular abnormalities have shown promise. Imatinib works against certain types of gastrointestinal stromal tumors. Pazopanib, trabectedin and eribulin are other targeted therapies approved to treat advanced soft tissue sarcomas based on tumor markers. However, side effects like fluid retention, liver enzyme elevations and hand-foot syndrome do occur. Clinical trials. Sarcoma treatments continue evolving through clinical trials of newer chemotherapy agents, immunotherapies, targeted drugs and combined modality approaches. Tests for tumor genetics and biomarkers help match patients to the most suitable investigational therapies available based on their individual cancer's biology. Palliative care also plays a role in advanced cases to maximize quality of life. Close multidisciplinary consultation involving medical oncologists, surgeons and radiation oncologists helps determine the best plan for each sarcoma patient. With a multimodal approach tailored to individual patient and tumor characteristics, the current 5-year survival rates for localized sarcoma are over 70%, worsening to 50 to 60% with regional spread and 20% or less for metastatic disease. Careful long-term follow-up after definitive local therapy also remains important due to the risk of recurrence even years later. Ongoing research aims to further improve outcomes and quality of life through newer systemic and targeted therapeutic options. Surgery and radiation therapy play an important role in treating localized mesothelioma and soft tissue sarcomas, while chemotherapy, targeted drug therapies and immunotherapy regimens are now available to treat advanced or metastatic disease or improve survival. A multidisciplinary care team approach individualizing treatment based on patient and disease factors offers the best outcomes. Ongoing clinical research also holds promise to further advance available treatment options and survival rates over time.